your retention bonus for teachers,
Yes.
but I was wondering if you could respond. Several educators in the state have said that, or have noted that stress, disrespect, and politics are some of the major factors that are leading to the issues of retaining teachers. Can you talk to their thoughts?
Listen, I said this is what I've made it very clear since I've been governor, the important role that educators play in our educational system. My daughter is a public school teacher, so I have a firsthand view of what's going on in the classroom. There's been a lot of challenges with COVID. We were able to keep our schools open, and I'm proud of our educators for keeping the classroom open and staying in school when a lot of other states did not. So this bonus is to say thank you for doing that, and we want you to stay in education. The other thing that I'm really excited about is the teacher registered apprenticeship program that we just launched, and that's going to allow school districts to actually grow their own workforce, and so they can, the kids can see firsthand from a teacher that they love and admire what that classroom looks like and what they can do if they want to choose that career path. Para-educators that are already in the schools that are helping, there's grant programming for them to help them complete their education so that they can become a teacher, earn while they're doing it, and no cost for the education. So I'm excited about that. Teacher leadership that we put in place for educators, they love it. It's been very successful. They were afraid that we were going to start it and stop it, so we rolled it into the foundational formula so that they could be assured that the funding would stay there. So, I'm proud of what we've been able to do for educators. We are working with the Department of Education and the University of Iowa on a program to also help educators deal with some of the mental health issues, and so we're really excited about that. I think it'll really provide a lot of benefit. I think we've done a little bit of that already through state funding, but I think the Department of Education, in collaboration with the University of Iowa, will really be something we can scale and be beneficial.
Hi, Kennedy Cook, Local 4 News. COVID numbers in Iowa are up. What are your plans to keep these ICU units down? Still no remote learning in place, still no masks today. Numbers are up in Iowa. What's the plan?
Yeah, I wish I had my map with me. I don't know if I've got no, it's in the car. I'll get it to you before we leave. The entire state is red right now. You can't tell a red state from a blue state because the entire state, the entire country is red because numbers are increasing. What we're starting to see is that the percentages of individuals entering into the hospital because of COVID is coming down. So because Omicron is so contagious, what we're seeing is they're entering into the hospital for other reasons, and then they're testing them, of course, and finding out that as a secondary they're testing positive for COVID. We continue to encourage vaccines. We continue to encourage people to stay home when they're sick. We're continuing to make testing available. So we're doing, what we can do. We've also worked with our hospitals at their request. They asked if we would be able to fund traveling nurses to help with some of the workforce issues, which a lot of this is truly workforce issues. They're no different. They're also getting sick even after being vaccinated and boosted. We're finding that the Omicron is breaking through, and not only are they still getting COVID, but they're still spreading COVID. So it's still happening, and so we've been able to bring in 125, I think is where we're at right now, to help alleviate with some of the workforce shortages to get through this. So we're hoping, we're continuing to monitor in some of the other countries that had the Omicron. They saw a really quick uptake, and then they also saw when it did start to diminish it rather quickly. But we're going to continue to provide testing, continue to encourage vaccine, and then continue to tell people stay home when you're sick. Thank you.
Thank you, Governor.